Subsidized healthcare programs. The rising costs of healthcare continue to burden governments and their citizens. There are three possible approaches to the problem. Each has individual advantages and disadvantages. The first option is subsidized healthcare. The second option is universal social healthcare. The third option is letting individuals cover all their own healthcare costs. Subsidized healthcare is health insurance paid for in part by the government. This type of program is funded by taxes that citizens of a given country pay. These programs can be subsidized on a national or local level. Subsidized healthcare is a balanced plan in terms of the burden it places on both the government and the individual. One advantage of the subsidization is that personal healthcare expenses are considerably less for the individual. However, the individual is still required to contribute a portion of these expenses as they are incurred, preventing exploitation of the system. Disadvantages include the continuing inability of the extremely impoverished to pay, preventing the administration of needed medical treatments for the poor. Thailand and Israel are examples of countries that have established subsidized healthcare. Universal social healthcare is a government-funded healthcare system that is available or compulsory for all citizens of a country. In this case, the burden of payment, regulation, and provision rests with the government. In such countries, private healthcare is still available, but there are also instances in which private healthcare companies are prohibited from competing with the public healthcare system. In these cases, the government holds a monopoly on healthcare services. Typically, the government finances this type of program via income or other taxes. One advantage of this system is that everyone has access to medical care. Many do not even require payment at the time the service is rendered. However, due to a common lack of competition in these systems, the wait to receive medical care can be quite long. Many of the world's more developed countries have established universal social healthcare plans, including Austria, Belgium, Germany, France, Spain, Canada, Finland, and Great Britain. The third kind of healthcare system is private healthcare. Private healthcare is characterized by individually owned companies, providing medical services and insurance that is paid by the individual. The government typically doesn't offer any assistance in paying for medical services. Supporters of this plan are convinced it both requires the individual to be more responsible in the use of services and promotes self-reliance. Another benefit is that it doesn't burden the government with administration. There is no need to find and pay health professionals to run the medical system. This plan also encourages competition, lower prices, and efficiency. One possible disadvantage is that the low-income sector of the population is without the ability to pay for any insurance at all. It is therefore highly likely that the poor would not receive medical services. In the event of extraordinarily expensive medical services, even some middle-income people might be unable to pay. The United States is an example of a country that requires the private sector to carry nearly the entire responsibility of individual health care. It is important to note that many countries use a combination of various healthcare programs. While a particular country may claim to have a universal social healthcare program, often it actually integrates aspects of the other types of healthcare into its system. For example, Portugal has a social healthcare system in the form of the National Health Service, which provides universal coverage, and it provides unique healthcare to professionals in such areas as education. But it also allows people the option of private healthcare. The social healthcare aspects of the program are paid for through taxation, and the individual covers personal insurance if he or she opts for private healthcare. A country with predominantly subsidized healthcare, for example, may still pay for all health expenses of citizens with incomes under a specified level. Other countries, such as the United States, have private healthcare but do have some minimal subsidized programs that finance a portion of the expenses for particularly at-risk groups, such as the elderly and the poor. Different countries have managed to assess their needs and formulate various healthcare system plans based upon those needs. However, healthcare system reform is still needed in many countries in order to provide for the medical needs of citizens within those countries.